Hello, welcome to the Testosterone Effect. My name is Dr. Jade, Teta, and in this program, we're going to be covering everything you need to understand about testosterone replacement therapy for the male. TRT, testosterone replacement therapy, and everything that goes along with it from start to finish. Lifestyle, exercise, the drugs you're going to need to understand, and the basic physiology of testosterone. So let's go ahead and get through this really quickly and go through an overview of TRT and what we're going to be covering. First of all, we want to give you an introduction to the program and the things that I really want you to keep in mind as you go through this program. First of all, TRT, testosterone replacement therapy, is restoration of normal levels of testosterone. We're not trying to go supraphysiological. In other words, we're trying to get to the upper range of what is normal. Ideally, the upper range of what is normal for a young man. We're basically trying to restore your normal testosterone levels. This is not the same as anabolic steroid use. This is about restoring optimal levels, not going too high in the levels of testosterone. Lifestyle change is essential. One of the things that most people don't understand when it comes to hormones is that hormones have to work in context. You just can't expect to drop a hormone into your system and have it do all this magical stuff. Testosterone only works when the lifestyle parameters are in place. That's why the nutrition and exercise component of this is so critical and why this is a very important part of the education you're going to be getting. Again, this is not anabolic steroid use. One of the things you're going to learn is that using synthetic steroids is not the same as TRT and actually can be one of the reasons that you have suffered with issues. Many people who have used anabolic steroids shut down their own testosterone production. These are not the same as your bioidentical testosterone, and this is not what we will be using. Very, very critical to keep in mind. TRT is very different than your traditional anabolic steroid use, which poses most risk, while TRT is a very healthy anti-aging thing to do. We will be using bioidentical testosterone in this program. That's what you will learn about, although we will cover a little bit about sort of some of the synthetics as well. One thing that comes to mind when we talk about testosterone therapy is this going to increase my risk of disease? This is one of these myths that will not go away. In reality, testosterone therapy, TRT, replacement of your normal testosterone levels, will reduce your risk of all diseases, especially cardiovascular disease. The research is pretty clear on this, even though we still hear reports where people get this wrong. Again, getting to optimal levels, not supraphysiological levels, and restoring your testosterone is very appropriate and healthy. Now, this program is going to be best for men in their 30s up to their late 60s, perhaps beyond, with symptoms of low testosterone. In other words, if you're someone who has low testosterone plus has a low or low normal corresponding lab value, this program is going to be best for you. Monitoring is critical whenever we're doing TRT. Whenever we're using a hormone, you want to basically get your initial labs done, and then you want to get follow-up labs done. We'll cover all of that in this particular program. And this program is really based on several different things here. It's based on the research, the latest, greatest research in testosterone therapy. It's based on my clinical experience working with many men and also my personal experience as well. I am someone who uses testosterone replacement therapy myself. Therefore, you're going to get this sort of baseline information as well as experience with me working with other men and myself. So let's get started with the program.